And we told you about that conversation, the conversation that is going to bring all the issues about child abuse and, well, all the concerns that not only parents but also who are related to children and abuse have. And it's about seeking to establish a one-stop model center where cases of child abuse could be reported and subsequently handled without any issues at all, so victims don't suffer further abuse. The whole structure and the model is one that has been taken from Malaysia and elsewhere, but it is now operational in several countries in the ASEAN or South Asia and Africa. Okay, and so we want to make sure that we have that type of model in our country as well. And so we have Christopher Latte. Christopher Latte is a senior program officer at the Department of Children of the Ministry of Gender, Children and Social Protection. He's a big man. Thanks for joining me, Chris.
Thank you very much.
But this model, and I've been trying to do a bit of further reading on the subject since the middle part of yesterday. It looked quite interesting, especially if you go to Europe and elsewhere. They seem to have the agencies very close by, and so the system has been made for it. That's what we want to do.
Exactly.
How novel is ours?
Yes.
Especially within our settings.
Exactly. Last year we had the opportunity to visit Zanzibar.
Oh, just Zanzibar? Close
yes.
to Tanzania.
Okay. Yes, and we had the opportunity to see their model. We visited the center. There was a health personnel, a social worker, and a police officer sitting there receiving clients who come, abuse children, women, men who come there. And therefore, when we saw it, we realized that it was a very good initiative that we could also replicate here in Ghana. And I would say that this issue has been on our agenda for some time, but we didn't know how to go about it. So when we saw the Zanzibari experience, realized that it's a very easy thing to do. So we then put steps in place to initiate it here in Ghana also.
But at the end of the day, it's for good reason. We want to make sure that people have access.
Exactly.
And then people have avenues where they can channel their grievances or concerns.
Yes.
But
yes.
It is also because the current status quo doesn't give us the opportunity to do so. How is that pervasive and a challenge for us currently?
Okay, so
having them disjointed and all.
Yes, currently, if a typical issue happens to a child somewhere in a community, the child will first of all have to go to the police to get a medical form.
At another location?
Yes, the nearest police station maybe, then walk to a hospital, which may be some kilometers away, then see a doctor, be in a queue, see a doctor, pay for the service, pay for the laboratory things that they will do, and then even for the consultation, then move on back to the DOFSU office and then to a social worker. Then if there is any other thing, go and see a legal aid or a lawyer, then go to court and narrate all these ordeals over and over.
That's inhibitive.
Indeed. And therefore, what mainly happens is that parents become exhausted, the children themselves become exhausted, and then they give up.
Yeah.
So when there is any compensation given, any point of the process, then they give up, then that does it with their case. And therefore, DOFSU has been mentioning that they are not able to proceed with many of the cases because of the challenges in the system, and because many of the victims also or survivors withdraw the cases at the end of the day. So they don't get persecution, they don't get justice for the perpetrators.
Quite laborious and very prohibitive, so to speak.
Indeed, indeed.
Now, so a typical scenario for this new model will be like what?
Okay, so what we are proposing is that...
Let's say I have a victim or a suspected victim. I may have covered a story. I want to take that victim to that center. How would it look like? How would the operation of the modus operandi be?
Exactly. So when such an issue happens, you just walk to the center.
Which could be located anywhere?
Anywhere. But we are proposing that it will be located on the premises of any health facility. Yes. So you walk to the health facility, you locate the one-stop center. And then, first of all, the first room you will get to will be the social worker, which will obviously be from the Department of Social Welfare. And then the social worker will give psychosocial support and also take the evidence.
After some interrogation.
After some interrogations, yes. And then you then move under the same roof, move to the police officer. Many of the cases involved are criminal cases. So then the initial investigations are taken. So if you have torn clothes, if you have some fluids on you, blood, all those samples will be taken and preserved. The shirts or other things will be preserved, the policeman or woman. As evidence. Then you also move to the victim or survivor will move to the medical officer to do forensic examination. So if there is some deposits will now take in order to get the evidence for court. Then if there is a need for psychological counseling, a counselor will be on standby. And then also if there is the need for a legal aid or a lawyer, the lawyer will be called on demand. So this will be the processes that we go through. So all these services will be under the same roof.
That's quite
You don't have to go through any traffic and all that.
So you have the collaboration or the support of the various agencies you're mentioning?
Yes.
DOFSU and all that. They're all ready to post people?
Indeed.
Personnel?
Yes. There was a workshop we held in Ho to initiate the whole process. And we had officers, top officers. The national coordinator of DOFSU was there, and other high-level police officers were there, and high-level medical officers and representatives from the Ministry of Health were also there. We also had policy makers. We had also from donor agencies. We had UNICEF there, UNFPA, and some international NGOs, and then the Department of Social Welfare and other psychological council. They were all there to discuss the issues to move forward. So we have the blessing of all the institutions that are going to be involved. The
medical officers, which category of medical officers did you say that you're going to post at the centers?
Okay, so as it is now, in the laws, you need a medical practitioner, as in a doctor, to sign the medical form. But, you know, we may not be able to get professional medical officers, as in doctors. Mm-hmm. So we want to amend some of our laws and train other nurses who are equally qualified to be doing those, because what will happen at the one-stop center will be to take initial evidence. So if there's the need to refer the case to another hospital for a deeper evidence to be taken, then it will be done. So we are proposing that nurses and other medical professionals can be there. So if the doctor will not be able to make it every time at the center, other medical officers who are not doctors could be there to assist in this.
That's quite interesting. Have you mapped out the country, and how many of these centers do you plan to establish?
Yes, our dream is to establish it in every district in the country. So we are looking at 250 something, but we want to pilot it and then situate it within our context to know the challenges that we'll be facing here in the country. Then we'll scale it up to all the districts. So we are looking at Kolebu Hospital to start with, and Lekma Hospital to start with in the Greater Accra
region. Because I was just about to ask you, we don't have that many hospitals, especially that many health facilities that could have an adjacent or perhaps another facility on the same compound. That's what I kept asking.
Yes. That may be true, but
So in the absence of the health facility, what?
In the absence, we can get any government institution that can host this. So DOFSU, any DOFSU office, any social welfare office, anywhere we can situate it is fine. We'll do that. But with the health facilities, at least every district has a district facility, health facility, a district hospital. And that's the main reason why we want it to be situated on the compound of the health facility. because they are in all the districts.
Your department and the ministry, you've taken cognizance of the fact that the ratio of the population to the hospitals are in thousands,
Yes.
tens of thousands. You acknowledge that?
Yes,
Okay.
yes, yes.
So if we do acknowledge that, and already even the people in the whole district or municipality don't even have access to such facilities, then it means that we're still going to create the same problem where people can't have access. Have you taken that into consideration?
Yes.
Because if one is going to be cited in one district at least,
yes.
and we have 200 and how many now? 54.
Yes,
50
something.
for 56 thereabouts.
Yes.
It means that now I think it's been scaled to 65 or so. Now ultimately, we're going to have only one in the whole district. Would it mean that the other allied agencies will still be working? The police, DOFSU and others will still be operating?
Yes, they will. Yes, so every police station will be operating and
the current status quo will continue.
will remain. But if they identify that you have come with a case which needs a medical attention,
then they'll go straight to
yes,
the
then
center.
they will refer to the districts. To the hospital or the facility, the one-stop center, for the process to continue.
Okay.
So we are collaborating with all these institutions I mentioned earlier. So whatever happens, anybody who receives the survivor will refer the person to the one-stop center.
How much are we spending on this, Chris?
Well, it will depend on the facility. If we
haven't budgeted.
No, we are.
What's the budget?
For every facility, as I'm saying, I cannot give a budget for the whole exercise.
You mean nationwide? We've mapped out Ghana, but we don't know the budget to do the rollout, or it's only a pilot for now?
For the pilot,
okay,
we are looking at existing structures. Okay. So Kolebu has something already, so we are looking at about 50,000 for Ghana cedis,
at least for a facility.
Yes, for
the setting up.
For the setting up and the initial running.
Okay. Who is going to pay the medical officers?
Yes, for all the professionals who are going to be there, they are going to be seconded from their mother institution. So the officer from the Department of Social Welfare is going to be seconded and paid from the Department of Social Welfare.
When are we going to have the first pilot?
We are looking at between February and April.
That's next year?
Next year, yes.
Which location? Kolebu?
Kolebu or Lekma. We are looking at these two, yes.
Okay. Thank you very much.
Thank you very much.
We've had some great discussions. And that's a senior program officer at the Department of Children of the Ministry of Gender, Children and Social Protection, Christopher Lante. Thank you for joining me, Chris.
Thank you.
It's been a great discussion. But we have to wrap up the whole show with some great entertainment on AM Showbiz. Please stay with us.